Today's topic is a very interesting one in terms of what is happening to oncology in general from a diagnostics perspective and also from a treatment perspective. And many people say that there are more cancer patients and at an alarming rate. And I think a big part of it is related to the early diagnosis and how much we are learning about cancer earlier than what we used to. So it is not that cancer is spreading in an uncontrolled way. We are learning more about it as a disease and also from a treatment measure. So with that said, today's session is a deep dive into oncology, hearing both from a clinical perspective and also from what the industry is doing from an R&D, discovery, innovation, and obviously both sectors work very closely with each other. So Peter, if you tell us a little bit about yourself.
Thank you, Mr. Marwan. So, hi everyone, my name is Peter. I'm currently the Oncology Business Unit Director for Astrazeneca. It's a pleasure to be here with you in this session. I've been part of this country for the last 17 years. The same period in Astrazeneca, different roles across different functions, and for the last 10 years I've been in the field of oncology with AstraZeneca. So pleasure to be with you, Marwan.
Thank you very much.
Hi, my name is Shaheenah Dawood, and I'm a consultant medical oncologist at Mediclinic City Hospital and professor of oncology at MBRU. And I've been here for forever in the UAE. I can't tell you how long. He doesn't mind. I do. You'll know my age then. It's a true honor, honestly, to be here. And as I was telling you, I think this is. I don't usually come to Arab Health, but I think this forum, for me, shows the perfect amalgamation of industry, hospital, and then, of course, from a country perspective of how we're trying to take the treatment of patients forward. And I think this amalgamation tells us that this is the way the future has to be. We can't work in isolation. We have to work as a team, and that's how we take things forward. I really like your comment about how oncology or cancer cases are increasing. And you're completely right. We simply don't know the exact epidemiology of what's happening in the UAE because of two factors. One, we're very dynamic and very fluid population here, so they're in and out. So there's no way of knowing whether it's escalating or not. But I think one of the reasons we're seeing a huge rise, and I'm sorry I'm answering that question before you answer because it's such a passion of mine. Is the number of people have increased in the UAE, and I think we'll automatically see a rise. So it's not only early detection, it's a growth in our population because of our growth in our country as well. So I think both factors are going to see a huge jump in the number of cases that we're seeing already.
But if we take a global perspective, right, for a minute, I mean, even globally, the incidents are increasing. Now, is that because the world is kind of aging as well? We're living longer, which is good, but hopefully we want people to live longer and healthier. So is that one of the reasons you think?
No, absolutely. I think one of the reasons is, our healthcare industry and, hospitals and our health facilities have become so fantastic that patients and people are living longer. And as you grow older, the risk of getting cancer also increases. That's a done deal. But what we're also seeing from a global perspective is an increase in the incidence of younger people getting cancer, more so in the Middle East and Asia. And a recent study done in the United States is actually showing that colorectal cancers, the incidence of it is actually increasing in our younger population. And there are a number of reasons for that. One is our lifestyle, our diet factors, and as you rightly pointed out, early screening. There are more younger people coming to me for screening than the older people, right? And let her introduce herself. Aydah just come in. Aydah?
I did not want to interrupt you, and I agree with everything she says actually. So I'm Dr. Aydah, a consultant medical oncologist from Tawam Hospital based in Aydah. Thank you for inviting me to be part of this fascinating discussion.
Yes, so just to bring you up to speed, we were just talking about how the number of incidents are increasing globally, not only in the UAE, and what could be, factors of that. Is that because people are aging globally, and with age you have higher chances, or there are other factors that you can think of?
So allow me to comment on this. I think I definitely agree. So there is an increase in cancer incidence that happens on a yearly basis across different subtypes of cancers. Maybe most commonly will be breast cancer, colon cancer, and we have seen also a trend of younger patients being diagnosed with cancer, specifically with breast and again colon cancer. And I think many factors attributes to this, including, as Shaheenah mentioned, the aging of the population, the median life expectancy getting better, given the advancement of the healthcare available. And then also the screening methods, early detection. We are doing a lot of mammograms. There's an increased awareness in the society about like mammograms, colonoscopies, and the different screening methods for different types of cancer. So I think we are not only diagnosing more cancers, but luckily we are also diagnosing earlier stage of cancer where cure can be, there is a good chance for cure basically.
How important is the role of awareness of early detection in cancer?
It obviously plays, I think, an even bigger role than what physicians play in screening. Awareness is the cornerstone. If you don't know your family history, or you don't present yourself when you have a symptom, obviously we are going to detect cancers at a much later stage. So awareness is very, very important. And in a country like the UAE, awareness is even more important than screening strategies. And the reason for that is screening strategies are geared for an older population. And if you look at the median age of diagnosis of, say, breast cancer in the UAE, and I'm only going to talk about the UAE, it's anywhere between 40 to 45. Screening for breast cancer starts at the age of 50. So you're obviously having a disconnect there. So we have to understand that we need to educate more people. We need to educate them in schools, in universities, in different areas or aspects of the growing population that we have here in the UAE. But we also, I think, as a team, and I know Aydah is part of the Emirates Oncology Society, where they're trying to put together guidelines to actually direct their efforts towards this younger population. And it's not that we have it's not that the incidence of younger cancers are prevalent in the UAE. The median age of the cohort in the UAE is very young. They're 35.
Right.
We have a huge expatriate population that come here to work and then leave.
Yeah.
These are young people, so we're going to see a lot of younger people have cancer.
Absolutely.
And we need to be able to address their needs more so now.
I 100% agree with you. And I think most of our guidelines is adopted from the Western world. And I think knowing more about the nature of the cancer diagnosis, the age of the median age of diagnosis across different cancer, I think we have to come up with our own guidelines. Maybe screening for breast cancer has to come earlier than in the Western population, because we are diagnosing patients at earlier stages. And then also for colon and rectal cancer, definitely. I think there are more effort needs to be done to put everything together and come up with the most appropriate age at the time of the screening that is unique to our population and to the rest of the maybe region as well.
Yes. Now, maybe I want to, I know you're both, very well respected oncologists, and I have a lot of respect for what you do. But at the same time, I think the role of the GP is very important. Because, a lot of cases when you're not sure or it's at early stage, there's something going on that you don't understand. And, you have all the knowledge and the training and the expertise, but the GPs don't. So is there something that the industry is perhaps doing?
Yeah, exactly. So Dr. Shaheenah alluded to the importance of awareness, and she mentioned in the beginning that it has to be a collaborative effort. So medical community and the oncology medical community cannot do this alone, and that's where our role can help, because you as an industry, you deal with all specialties across different portfolios, across different, medication classes. So this is the leverage that we can help with, that we can find these points of connection between the physicians across the patient pathway. Because as you mentioned, Marwan, so cancer patient, in order to be detected, will never be at the desk of oncologist. It has to be either on the desk of GP or internal medicine, pulmonologist, for example, if it's lung cancer. So that's where our role in, that to find this connection, building on how we are dealing with different specialties. This is how we can help. And also on the point of awareness, why it's important, because we can see now different types of cancer than the usual ones that have taken lots of focus when it comes to media, from awareness perspective. So we're seeing lots of new types of cancer that's also important to increase awareness, and somehow they are, it's unfair for these, I'd say, patients.
Like what? This is your chance to talk about.
So yeah, so for example, liver, I would say, cancer, biliary tract cancer, these are types of cancer that are growing in numbers. Still is not as big as in terms of numbers like breast cancer and colorectal and cervical cancer, but still awareness can make a big difference, because eventually they are fast progressing cancers. And 1 or 2 weeks can make a difference between the staging, and of course the physicians can elaborate further. So awareness also needs to go beyond the normal, the types of cancer that we've been hearing, to go for these new emerging, I'd say, types of cancer.
Absolutely. I've given a lot of these talks on awareness, and whenever I go to any institution, the first thing I tell everyone, get yourself a GP, register with that GP, and have a healthy person checkup once a year. That's what the NHS does. That's what the Canadian system does. In the US, that's what they do. Everyone has to have a GP or a pediatrician, depending on the age of the person. And I'm sorry to say that is lacking over here. The whole concept that you should have someone like a GP or a family physician sort of assess you every year, that is lacking. And not only having the GP, having the same GP every year, because you need to have consistency in your management as well. And that needs to be advocated. I disagree that they're not trained. I disagree that they don't know how to do awareness. What I agree with is that people don't go to the GPs to get themselves screened. So I think I have a lot of respect for our GPs and family physicians. I think people need to go to them so that they can start being screened.
And the more people go to them, the better, right? Because that's how they build their knowledge.
Maybe this is something you can advocate. I know there's a mandate in the UAE that every person that comes in should have insurance, for example, in Dubai.
Right.
So we should mandate that every person that comes in should have a registered GP as well.
Oh, I like the concept. I mean, I believe in it 100%. And, a lot of health systems use it as a model, the gatekeeper model. I mean, some countries, they have that system and they're very strict. And what GPs do is they sit all day and they write referrals without actually, interacting with their patients. So that's, I think people need to believe in it rather than for it to be imposed.
Absolutely.
So, but yeah, family doctors are very important because, you have family history, etc. So, yes, 100%.
Most of the time that when it comes to breast cancer screening, we are at the back seat, really. The patient only comes to us when they are diagnosed with breast cancer. So it's a whole spectrum, from the individual, family, community, family physicians or GPs, and then it comes to us. So we are really, every time in October, for example, they ask me to give these educational screening. And I'm like, yeah, we have to extend it to family medicine. They have to be the one to initiate these discussions. Of course, that's our job too, but I wish in October to see more and more family physicians are actually engaged in these screening campaigns and guidelines as well.
Right.
I actually tell Aydah all the time that I completely don't like October month, because cancer doesn't only occur in October.
Exactly.
It should be a year-long screening process, and that's where family physicians come.
Yeah. Let's talk about research a little bit, because that's a cornerstone of finding new things and also coming up with things that are more relevant to the UAE and to the region. I know there has been lots of efforts from the industry side. You have also been involved. So, Peter, let's start with you.
Yeah, I think that's the fundamental role of industry, is to find new treatments. And when you look in the last 10 to 15 years, I think there has been significant advances in the platforms that are being used to discover medicines, the mechanism of actions that we're trying to explore to harness, I'd say, either to attack the cancer or to harness the immune system to tackle the cancer or to educate the immune system to tackle the cancer. I think, but one of the biggest advances was more targeted treatments, because this is where you can achieve the biggest impact. And very simple, I would say, resemblance is as if you are taking an empirical antibiotic versus you are taking an antibiotic that was based on a specific, I'd say, cultural test. So that's the beauty of targeted test and target treatments. And I think targeted treatments have been significantly advanced across the whole industry, and they played a major role in improving survival, I'd say, outcomes with cancer globally, not only here. But just to be also clear, this comes also with a significant amount of education and has to be access to the latest molecular testing or diagnostic testing, because these targeted treatments, they are usually given to a certain population of patients that they have to be, I'd say, tested for a certain mutation or certain molecular test. So it's not only discovering, I'd say, the target and the treatment, but also making sure that these tests are available and accessible. So the role of industry does not only stop at the point of discovery of these targeted treatments. I'm here focusing more on targeted treatments, but also on working with the community, working with the healthcare system to make sure that these tests are accessible so patients can get access to the treatments. And in Astrazeneca, the way we think or look about this, we look on it from three aspects. The first aspect is, first of all, we increase the awareness together with the medical community, the oncology medical community, increasing the awareness about these tests. So, for example, if you're a lung cancer patient, it's not going to be the same with other lung cancer patients. Each patient is different, and that's why you need to have access to this test. And this comes, the second part is to have the access to make sure that the infrastructure of hospitals are.
But you're a pharmaceutical company, right? You're not a diagnostic.
Yeah, so that's
tell us about that.
Yeah, so that's why in Astrazeneca we have now a dedicated group for diagnostics, and I think many companies within the industry are adopting this approach, because you need to have people who work with the external, I'd say, community to make sure that these tests are available from infrastructure perspective and also from education perspective. Last but not least is the accuracy. These tests are very important to have a certain KPIs from time, for example, to report the results, the quality itself, and again, this is one of, I would say, priorities as industry.
Could I ask you a question? And your pharmaceutical industry representing them here, and of course I'm going to put you on the spot. So you put some very nice aspects forward. Targeted therapy, diagnostics, awareness. I think that encompasses everything except one part, and that's price. It's not going to be accessible to everyone. And I'm not talking only UAE here, I'm talking globally. And I think as a community, and I think, Mr. Marwan, that's where you come in as well, with your part, that how can we as a community work with industry to bring the price down? Because it shouldn't be just for the elite, it should be for everyone. And I think at least that's the way I feel.
I 100% agree, and I think with having more and more advanced technology and adopting the personalized oncology approach, the cost is getting higher and higher. And I think we all as a community, starting from physician to administrator to lab technicians to laboratory, personnel, we all have to come together to find a solution, and of course with the help. I mean, I know industry has also been a great asset in terms of providing some of the diagnostic tests that we can use to select the appropriate treatment for the patients, which a lot of patients they can't afford. So that is one advantage. So we need to go around and find solutions to try to benefit the patient and lower down the cost and maybe make healthcare accessible again to all.
Yeah, and I think that's another great advantage of living in the UAE. I think as a country, the country has provided many platforms and vehicles to accelerate access to these treatments. And from our side, I think many pharma companies now, they have introduced multiple platforms to support as a patient support programs that has been endorsed by the Ministry of Health. Of course, more work needs to be done. And every couple of years, we see a new platform provided by different authorities across the UAE that can help, I'd say, patients to access these treatments. But there is also an important part, which is the indirect cost. And that's again the beauty of targeted treatments, because imagine if you are a patient and you start treatment that cost you, for example, thousands, but it was not the right treatment for you. It was not the treatment that will give you the maximum efficacy, and that's a very important part. And we know lots of patients that have, I'd say, did not, I'd say, follow this, not in the UAE, but different parts of the world, and the incremental cost that they had to pay for. But definitely the cost will continue to be an absolutely important point. And that has to be between authorities, between pharma, to make sure to maximize the access. So I agree with you.
Just as a final comment to that, and then I'll say the next thing that you didn't bring up as well. My final comment on that is cost is very, very important in any country, but we should also learn from other countries. For example, if the cost of drug A in the US, because that's where it first gets released, is say an X amount, that's not the amount that we should adopt. We should adopt it at a lower price to allow it accessible. Europe has a very good system where, yes, they're obviously not everyone's getting the drug, that's a different thing, but they bring the costs down. And maybe we should now find ways of working with pharmaceutical industries to, at least for our population, to bring down that cost. The second thing that he said that was so super important is that if you don't deliver the right drug to the right patient, you're just giving the patient toxicity. And I think that what we lack here in the UAE, or perhaps even in the GCC countries, and I'm sure Aydah will agree with me with this, is that we don't have our own data. And amazingly, drugs get approved in the US. The second country is UAE, which is fantastic, and that's why we are proud to be here. Our patients get the best treatment. But we should also, with that, mandate that when we're treating our patients with these novel therapeutic agents, collect the data to see are they doing the same as in the North American and European population. And that's the way to compare and contrast and even, harvest our own data.
If you allow me to add, I definitely agree with all your points. But if we add, it's the clinical trials. When any drug is approved, the representation from our country in that particular study is not there. And we don't know whether these medications can actually work in our patient the same way or not, as Dr. Shaheenah mentioned. So I think one part, we talk back to your question about research, I think we need to invest more in research, real world experience, but I know Astrazeneca and other pharmaceutical companies are invested in. But not only that, but to allow clinical trials to be here in the UAE, phase 2, phase 3, and even phase 1. And to have the right channel for our patients to be able to participate in these trials and make up a decent number of the population in the trial as well.
Yeah. This was actually my following question, but you kind of started the discussion, which is what can we do collectively, not just industry or the scientific communities, to put the UAE on the map when it comes to research and specifically in oncology. I know that we are a small country, we don't have a big pool of patients, but we have other things that can contribute to that, whether it is the Emirati Genome Project, whether it's the AI initiatives that are happening. So, we can start with you, Peter, of course.
Yeah, I think it's clinical research is a very important point. Dr. Aydah and Dr. Shaheenah touched base that we need to have our own local data for UAE. And back to your point, I think UAE is already in the map because Dr. Shaheenah mentioned the medication gets FDA approved the second week or after a month it gets approved in UAE. So from, I'd say, map perspective and focus, UAE is there. I think we need to do three things. The first thing from our part, as industry, we need to make sure that UAE is always prioritized site for such, I'd say, clinical research projects, which I think we also need to be making sure that we are selecting the relevant types of cancer to make sure that we first tackle the biggest, I'd say, unmet need, and that's our role. I think the second thing is to work with different entities in the ecosystem to make sure to highlight the very good infrastructure that we have now. You touch base on AI. So patient selection, all these things can provide assurance that, because when you do a clinical trial, you want to make sure for patients to reach the medication faster. You want to make sure that this clinical trial is successful. This kind of infrastructure will help the patient selection, right patient selection. So definitely it will boost the confidence that you can bring a phase 2 or phase 3 study. Last but not least, which is usually something that we discuss with our oncology medical community, and to be honest, the last couple of years there has been significant advances to how to make sure that everyone is connected, because we have different, I'd say, sectors, different authorities, how to make sure to build this network. Because at the end, the population might be, as you mentioned, might be, I'd say, a challenge. So how to make sure to have this connection across different authorities, across different institutions, to make sure once we have this trial up and running, we commit to the timelines. So I think if we work on the 3 areas, we will continue to see a rising number of clinical trials coming to UAE.
100%. I agree with every single point that you've mentioned, but I think we can do something tomorrow. And I think the things that we can do tomorrow is, number one, like I said, when you have a registered drug come in that's new, we should mandate that every institution that's using that drug put their data into a central database, and that's collection of data. That is gold in my mind. So that's number one. Number two, unfortunately, although institutions have the capability, and I'm going to say we have huge capability, better than the US, better than Europe, in terms of conducting clinical trials, unfortunately, pharma don't want to bring a lot of their clinical trials to the UAE because it doesn't make sense for them, maybe on a money perspective or a global perspective or a fast track perspective. We need to, as a country, approach pharma and work with pharma and say, no, we want these trials here. We'll commit to getting these trials successful. So we have to make that commitment. And I think thirdly, we need to start fast tracking. There are just too many hurdles in terms of getting these clinical trials up and running. And I think we've both been part of those hurdles. And I think it's very easy to bring down those barriers by more awareness that these trials are indeed very, very important. So I think these 3 aspects need to be done. There's so much being done already. I mean, I work at MediClinic and we have all the SOPs in place, and we've worked with Astrazeneca. We've got the Cambria study that's coming. I'm so excited about that. It's an oral SERD for adjuvant setting, which is going to be, I think, explosive in the future. And we will be one of the first institutions, together with Tawam, that's going to actually have that data for our UAE patients. Why is this important? Because our cohort is very unique, and that's my 4th point. It's time to study the unique population that's existing in the UAE. We have cancers that people in the US have never seen. The number of times I've consulted with doctors in the US and Europe where they actually say, Shaheenah, we've never seen a case like this. Because we have a unique cohort here, and it's time for us to bring that out and actually share our experiences, because I think the pharma industry, and I think the powers that be globally that do clinical trials, can learn from us and we can learn from them.
I definitely agree with all of your points. I think there is a big challenge. I mean, the first challenge is we have to show that we are capable of doing it. And the more we show, the more attractive it's going to be for the pharmaceutical companies and different companies to invest in such a trial in these institutions. I think this is a big step there. We have already started clinical trials in Tawam and MediClinic, and I know recently in Cleveland Clinic as well. So I think we are bridging a gap, but at the same time, we talk about like pharma-sponsored trials and company-sponsored trials in general. But we don't talk about investigator-initiated trials. So I know that our country provides a lot of opportunities to apply for grants, and we have many of us trained to write protocols, clinical trial protocols. I know Shaheenah, you trained at MD Anderson. I did at the same institution. We are trained. I know how to write protocol. Why I can put it together and then apply for grant? But I think grants are very limited here. And I think I know DOH provides grants to Jalila Foundation, but we need more of that to motivate researchers to take the initiative and create their own clinical trial. And I think that's one of the ways to show that we can do it, and we have the infrastructure for it, and we have the mind.
To end the panel, thank you very much. I know you're all very busy doctors and you need to get back to your patients. So thank you for your generosity, and we'll be in touch. Thank you very much.